I like to see results of my intervention. All physicians want to see good results from their treatment of a patient, but I can see it immediately, and I like that aspect of my practice, where I can influence the course of a disease or influence the patient's view of his or herself. I enjoy being able to make people happy immediately. And it's the kind of thing where when people heal from the surgery I perform, they look better and better as time goes on, up to a point, as they heal from the surgery. So it gives me a great deal of satisfaction. I've wanted to be a plastic surgeon for many, many years, and I feel that I am in the right place, and I just enjoy myself every day. I look forward to coming to work when I'm on vacation. I can't wait to get back to the operating room. At the time I became a plastic surgeon, it was traditional for people to first become a general surgeon before going into a plastic surgical residency. And even though I was pretty certain early in my training that I wanted to be a plastic surgeon, it was necessary for me to be a general surgeon. And I did enjoy general surgery. I took a full general surgical residency, and while I was chief resident in general surgery, I was appointed a plastic surgery resident at another institution. And so I eased from general surgery into plastic surgery after the residency was completed in general surgery. Yes, well, that's an excellent question. General surgery, I think, really prepares an individual to become a plastic surgeon, because the skills that are necessary in plastic surgery can be derived to a great extent from general surgery. A lot of what we call surgical principles are principles that one learns as a general surgeon. And then when we go into plastic surgical training, we utilize those general surgical principles, and they evolve into plastic surgical techniques, but the underlying foundation of our surgical skills is in general surgery. Very rarely, but there have been times when I've done an abdominoplasty or tummy tuck and have encountered a hernia, and the hernia had to be repaired, and rather than having to call in a general surgical consultant, I was able to treat the problem myself. Also, when we're in training as general surgeons, we learn certain principles of metabolic care and care of the post-operative patient, and that has been very helpful to me in my career as a plastic surgeon. I think I've been able to give my post-operative patients better care because of my foundation in general surgery. Actually, I enjoy the full range, the full scope of plastic surgery. I do a lot of head and neck surgery, facial surgery, eyelid surgery, etc., rhinoplasties, which is surgery of the nose, but I also do a lot of what we call body sculpture surgery. For example, the so-called tummy tuck or abdominoplasty, and various types of liposuction. I enjoy doing them. I think I've refined my skills over the 37 years of practice that I've had to be able to do them well, and I love every minute of it. Yes, for my entire years of my career, I've been in private practice until September of 2009, when I joined the staff at Strax. Strax is wonderful for me because I enjoy the collegiality that's here. The doctors, there are several of us, can speak to one another about problems. We can solve problems together. We can cover for each other if we're out of town. If one of us is out of town, another doctor will be able to take over the case. So there is good continuity of care, and I trust the other doctors here to take care of my patients. They're all wonderful surgeons, in my opinion. So it's really become a very comfortable way for me to practice. A relatively recent example of about 2 months ago, one of the surgeons was doing an operation on the patient's breast and was concerned about the circulation to the breast and wanted my opinion to see whether or not there's anything special that surgeon should do. And I came into the operating room and recognized the problem, made some recommendations, and everything turned out beautifully. Gave me a great deal of satisfaction, and there was a certain amount of gratitude on the part of the surgeon. Now, I'm sure that I'm going to have the opportunity to call upon my colleagues for help sometime in the future. So that's a wonderful feeling, knowing that I have this backup, that I have people available for advice, which I didn't have in private practice. One of us reads an article in a magazine, a surgical journal, and we discuss it very informally, but we all derive a great deal from those discussions. We learn these new techniques. Maybe the first time we try them, we have the help of one of our colleagues, and it's a great way for us to refine our surgical skills and our judgment as well. There's a lot of unpredictability about the human body. We're not all exactly the same, and many times we expect a relatively simple procedure, and it turns out that there are unexpected challenges that we have to face. And if we have the proper training and experience, we can usually handle those challenges. If we have difficulty handling those challenges, we can call for help, which is wonderful. And we all know that we have backup for our operating room experiences. We have somebody to call upon to give us a hand if we need it. I, as well as many surgeons, derive a great deal of pleasure from meeting new patients, potential patients, discussing with them a plan of treatment, and following them after surgery. Now, sometimes there is not a meeting of the minds between the doctor and the patient, and if that, if that occurs, we can always have one of our colleagues meet with the patient. I'm happy to say that I have very good relationships with pretty much all of my patients. And I think one of the reasons is I truly love interacting with my patients. I consider them, after a short period of time, to be my friend. So I enjoy it. I really, there's so few negative things I could say about my practice, about my experience here at Strax. It's been almost all completely positive. I love the staff. I love the administration. I think the owners of the facility certainly defer to the medical judgment of the surgeons, and they respect us and we respect them. Definitely, we don't have to worry about what fees are being charged the patient. We don't have to be concerned with paying for personnel, for staff. We know the administration will give us adequate help, adequate staff members. And the staff members, I should mention, for the most part, are really excellent. They're wonderful people. They don't get burned out. They are truly involved with the patient and give their all for each patient. So it's really wonderful. That's an excellent question, and it's absolutely true that we get what we need here. We don't have to fight for equipment, nor do we have to pay for it out of pocket. If the administration feels that purchase of a particular piece of equipment will be helpful to building the practice for productivity, but also good for the patients, they're inclined to purchase it or rent it or lease it, however they do it. I don't get involved in the acquisition of the equipment, but I know that it's there when I need it. It's very interesting that you should bring this up today, because just today I was in the Boca Raton office and I met a patient, a potential patient, who came for a consultation. And she told me she was leery about coming because she had heard it was a factory-like atmosphere at Strax. And she really was very positively impressed by what she saw. That everybody, every staff member that she met, including me, I'm happy to say, really was wonderful. She really enjoyed meeting us, and she is going to be having the surgery. But it is true that we have a huge practice, and a lot of people fear that this might be a factory type operation, and it really isn't, primarily because of the wonderful administration we have and the terrific staff. And I believe that the doctors are chosen on the basis of not only their experience and their training, but also on their affability and willingness to help people.